Hi, my name is Drew Woodrow, and I'm the Program Director of the Diagnostic Radiology Residency at Spectrum Health, in partnership with Michigan State University College of Human Medicine in beautiful West Michigan. I myself am from the great state of Michigan and have the distinct pleasure of leading our incredible group of men and women training to be radiologists. Our goal is to support our residents in becoming the best radiologists in the country, so they in turn can take the best, high-value care of the patients in Michigan and around the country. We are a small, tight-knit diagnostic radiology program of 12 residents. The size of the program allows you to specifically tailor your radiology education to your own goals. Our mission? To educate residents to excel as patient-centered, critically thinking radiologists who work to improve the health of their community. The variety and number of cases we see is unmatched anywhere in the country due to the large size of our hospital system, paired with the small size of our residency program. Another benefit of our program is the integrated transitional year at Spectrum Health, giving our residents all the tools they need to begin the radiology residency without having to move after intern year. All of our recent residents have gone on to fellowships, including at such institutions as Duke, Johns Hopkins, University of Michigan, Mayo, Stanford, and Mass General, just to name a few. Our residents go on to practice in a wide variety of settings, including academics, subspecialty private practice, and multi-specialty general radiology. Our residency utilizes a diverse set of tools for education, including 90 minutes of didactic lectures in the morning, Monday through Thursday, a robust visiting professor program with 20 to 25 distinguished visiting professors each year, dedicated education in AI and informatics, as well as a newly established track system to supplement their non-interpretive skills and provide them with a capstone experience in their R4 year. Tracks include clinical educator, research, AI informatics, quality improvement, advocacy, and leadership.
Hello, my name is Jamie Frost, and I am the Associate Program Director of the Diagnostic Radiology Residency Program at Spectrum Health in partnership with Michigan State University College of Human Medicine. I moved to Grand Rapids after spending most of my life in New England and was surprised at how much the area had to offer. I moved here for the job, of course, but also for the lifestyle Grand Rapids offered, year-round outdoor activities and a quick commute to work. But I soon realized the area had so much more to offer, including a wonderful downtown scene with culture-rich museums, theaters, and great dining options, as well as an amazingly welcoming and friendly community. You'll hear more about this from our residents. But it was this welcoming, friendly community, even inside the hospital walls, that drew me to be involved with our residency program. As Dr. Woodrow mentioned, we are a small, tight-knit diagnostic radiology program with a mission to educate residents to excel as patient-centered, critically thinking radiologists who work to improve the health of their community. We feel exceptionally prepared to do this for two reasons. One, as we have a unique experience that our residents work with two separate private practice radiology groups. One group, Advanced Radiology Services, is one of the premier subspecialized radiology groups in the nation, with over 150 attending radiologists. Most of the training time is spent in this practice setting with fellowship-trained subspecialists in all areas of radiology. A tremendous benefit of the small size of our residency paired with one of the largest radiology groups in the country is the faculty-to-learner ratio and the case-based to learner ratio that is unparalleled anywhere in the country. During the recent COVID-19 pandemic, where many radiology residents turned to online learning, our residents were able to continue to see cases due to our huge advantage over other programs in case-to-learner ratio. Our second group, Kent Radiology, by contrast, is a smaller general radiology practice. This opportunity allows the residents to experience the more classic private practice setting, getting exposure to bread and butter cases, multiple procedures, and cultivating a more autonomous growth in the residency training. Second, the Spectrum Health system is the second largest hospital system in Michigan. The radiology residents are part of 15 residency programs offered at Spectrum Health. The Spectrum Health hospital system has 14 different hospitals, including the 241-bed standalone Helen DeVos Children's Hospital. The residency training is based at the Grand Rapids Level 1 trauma centers for both the adult and the children's hospital. This educational-centric learning environment provides opportunities for the residents to see a vast array of case types, teach medical students, teach residents of other specialties, and be involved in leadership positions, as well as participate in multidisciplinary conferences. With that, I thank you for your time and your attention, and I welcome you to come visit our great city, virtually or in person, anytime. Thank you.
Our day starts at 7:30 a.m. when the residents meet in our conference room for daily lectures until 9 a.m. We have two 45-minute lectures every morning with a rotating curriculum from all our radiology sections, from breast imaging to musculoskeletal to neuroradiology. After our morning lectures, we go to our designated rotations. When it comes to spending an actual day in our seat, it's very comfortable, quite literally. We have individual reading rooms, ergonomic tables, and lighting designed for interpreting images. Our 6-megapixel barcode monitors are seamlessly linked to Epic, our EMR system. We have a strong support staff whenever we have technical and logistical questions, and a massive traditional and digital library whenever we need our questions answered. On a typical day, we have one staffing session with the attending in the late morning and another in the afternoon. We have a designated 30-minute break for lunch. The structure is obviously malleable depending on other resident commitments, whether it be one of our numerous specialty-specific tumor board, interdisciplinary conference, or lecture from our visiting professor program. Staffing cases is always exciting, which is due to a number of reasons. First, our attendings are some of the best in the country, all of whom are subspecialty trained and engaged in resident education. Second, we see a wide variety of complex pathologies from all over the state, so there's never a shortage of interesting cases. Personally, I enjoy how autonomous we are as residents. With our independent overnight call, we function as the radiologist. While daunting, this is hugely beneficial to our training in becoming confident radiologists. You will leave this residency beyond prepared for practice.
On top of a lot of wealth of learning cases, Grand Rapids has a lot to offer outside a hospital. It's the second largest city in Michigan and only a short drive away from the beaches of Lake Michigan. Grand Rapids has been named Beer City, USA, and has a bustling downtown with local concerts, Broadway productions, eclectic restaurants and bars. At the same time, Grand Rapids is very accessible to beautiful parks, ski slopes, and trails for those who enjoy the outdoors.
Thank you so much for taking the time to learn about our program, and we can't wait to see you virtually here in Grand Rapids.